our focus right now is very much a deep dive into the basic blocking and tackling. What do we have? Where do we have it? Are we utilizing it to its full capability? And is it something that we think is going to provide value for us as we continue this kind of maturation process from what was a single campus entity, not so long ago, to now a full-blown health system?
From healthcare IT leaders, you're listening to Leader with Ben Hilmes. Our guest today is Seth Peterson, Chief Technology Officer at Moffitt Cancer Center. Seth has led Moffit to long-term success with his efforts to organize and scale data as the center has taken on an increasing number of patients.
Welcome to Leader. It's great to have you on the call. I'm really excited to see what you guys are doing at Moffitt Cancer Center. I have spent a ton of time around Moffit as a client throughout the years. And I can tell you every time I'm there, it blows my mind just the amazing things that organizations that you guys are doing, to take care of people that are going through a really tough time. So hats off to you and the team for all you're doing there. It's centered in Tampa, which is one of the fastest growing cities in the country. And along with that, Moffit is seeing significant growth. So,
right.
You opened a hospital last year, you're breaking ground on a new campus.
Right.
Talk to us a little bit about Moffit, kind of what's the mission, the vision, kind of where you see it going.
Yeah. Well, first of all, thanks for having me. Excited to be here. So Moffit's mission, very simple, to contribute to the prevention and cure of cancer. It's right on the side of our Magnolia campus. So that's it, plain and simple. So everything we do is geared towards exactly that. So Moffit, while we're Tampa based, we do see patients from all 67 counties in Florida, all 50 states, and over 130 countries. So our patient volume is more than just 35-mile radius that we're kind of inside of Tampa. So as you mentioned, we did open a new surgical hospital in July of last year. It's already at 90+% capacity. We have broken ground on our Spiros, Florida campus, which is about a 775-acre tract of land in Pasco County. And we've broken ground on a handful of buildings. As you mentioned, it'll be a mixed use property of which Moffit will own all of the land and have some of their own buildings and lease some space, et cetera. Everything that we're doing now, our concentration is to support this growth. But what are we going to look like 5 years from now? Because we're going to double our patient volume. We're not a merger and acquisition company. Everything we do is organic. We build buildings and see more patients. So it's how do we support that growth over the next 3 to 5 years, and then obviously beyond.
Well, that's great. It's growth can be incredible opportunity, but it also creates a ton of challenges. And if you're an IT guy, I've spent my entire career, you have too, kind of inside information technology, but help me understand kind of the challenges that the growth has on you as an IT leader, and really kind of contrast that to you're spending a ton of time just keeping up with the growth, yet at the same time, I know you have a strategic plan. So you're trying to balance the now and next. Talk to me how you put all that in perspective and execute against that.
Yeah. So the really bad analogy that I use with my staff is Moffit is like a 6'10" 12-year-old. So there's been a ton of growth. There's more growth ahead of us, and there's a considerable amount of maturation and catch up that has to happen. Our brain and our feet are not necessarily on the same page at this point. So, our focus right now is very much a deep dive into the basic blocking and tackling. What do we have? Where do we have it? Are we utilizing it to its full capability? And is it something that we think is going to provide value for us as we continue this kind of maturation process from what was a single campus entity, not so long ago, to now a full-blown health system?
Let's talk about data center. So, in traditional technology speak, the data center was kind of the hub, the heart, if you would, the thing that CTOs took pride and joy around, and many, many still do. But all the dialogue is, how do I get out of the data center today and get on this journey to cloud? Talk to us about how you are thinking about that, how you're applying some of these new principles, and kind of where are you on the journey, and what do you expect to achieve through all of that?
Yeah. So not unlike, I should say, other institutions that are, have gone through this kind of this transformation process. We're predominantly data center driven today, just because that worked. Things just kind of sat there and ran. We know that we've got some large projects coming up, like an ERP project, for example, that's going to shift a significant amount of that data center, to the cloud. But as we're going through the kind of this assessment, for lack of a better way to put it, or our deep dive, we're looking at the assets that we have in that data center. Does it make sense for them to stay there? Does it make sense to move them to the cloud? We look at just our data in general, data classification, data governance. How's it stored? Who accesses it? What makes the most sense for that moving forward?
Yeah, that's a lot. I mean, it sounds like you're being really great stewards of the investments you've made, right? Understanding how do I get the most out of those, and yet at the same time, as you're planning for the future, it's not just the immediate future, but understanding you guys are becoming, a sizable, scalable organization. So decisions you make today have to be able to scale kind of beyond the near future, which is it's a lot of brain power and decision making that has to occur. A lot of dialogues, a lot of buy-in. It's a lot of work. So speaking of that, so as you're growing, your org is growing. So let's talk workforce a little bit. So as you guys have grown, are you finding you guys are being successful at being able to hire into the demand, or are you looking at different models? Lots of discussions about outsourcing, managed services, offshoring going on in the industry. How are you guys approaching the workforce challenge?
We're struggling for the same talent, that everybody else is, obviously, like the cloud engineers, data scientists. To answer your question, we're approaching it with all the ways you just mentioned. We're looking at nearshore, we're looking at offshore, we're looking at managed services, insert in the acronym you want,
right,
as a service, infrastructure as a service. We're exploring everything currently. But what's key for us is that our staff understands that this is about augmentation, not about replacement. We've got a very talented group in our IT department. So how do I maximize that skill set?
I love that. I mean, I appreciate the transparency. I assume your associates do as well, as being part of the solution versus, getting the boom dropped on them on here's the way we're going without any input. So I know that's highly appreciated. I'm sure relative to all of this, AI has become, a buzzword, and there's lots of dialogue around it's going to be transformative, and then there's lots of concerns about security and safety, and especially as you start to apply it to care delivery. How are you guys thinking about AI? How are you using AI? Kind of what's your general thoughts on, that topic in general, and then how you're applying it to your work there at Moffit? We
have an AI ML a research department. Mm-hmm. So they've got a number of projects underway, where they design, develop, translate kind of patient-centered, machine deep learning algorithms, from an oncology perspective. So they've got their stuff going on. On the other side of the house, we know people are accessing ChatGPT. We know that it's happening. But from a Moffit perspective, we're moving cautiously. We're piloting Copilot. So we have that kicking off relatively soon. We're baby stepping our way into this. The first question is, our permissions set accordingly, kind of across the house. Obviously a very, very key thing to look at before you flip the switch on something.
Right.
We're a heavy Zoom shop. So from a Zoom AI perspective, that's something that we've been asked now multiple times here very recently. Can we turn that on? Well, it's not quite as simple as just turning that on. We have lots of questions surrounding access and how can we, section some of that stuff off. So we're, and again, that's a basic one, but we're trying to figure out what works best for us before we just, let the masses start accessing anything AI related.
Yeah, I don't think that's dissimilar from most health systems across the country. I mean, they're highly optimistic, yet, have to be very intentional about, their organization, the, potential downsides that may come with some of this advancement. So I think, and it doesn't surprise me. Moffitt's always been a very, intentional, deliberate. Yeah, that's a great word for it, because they really do have their agenda. They're going to continue to drive and not be, too easily swayed to go one way or another. So it's good that you guys are sticking to your core, which is good.
Right.
So we're going to pivot to leadership and talk a little bit about your career journey. You've had some CIO roles. You just came from Mount Sinai a couple of years ago, now at Moffit. Talk to us about your career journey. Talk about being a CIO. Did your experience as a CIO really help you in your current role as a CTO? Talk about that journey for us.
Yeah, so most of my career has been in healthcare. I had a short stint as a CIO in government, which probably will never do again for lots of different reasons. Having that CIO experience to me has been invaluable. Having responsibility for the entire shop and smaller places, you learn what you get to learn the holistic view. I'm not a clinical person by training. You don't want me to be. But having those relationships and understanding that side of the house as I kind of progressed through my career, having applications, and sitting on leadership teams with CNOs and CFOs, et cetera. Even though I don't do that today at Moffit, but understanding that side of the house, where our piece fits into all of that. We're very much a support part of the organization, and I understand where we fit into the big picture. And so we can insert that into discussions. And when I go talk to and have meetings with, folks at the VP level about their plans, as it relates to, their portion of the business plan, I understand that, based upon, past experience. And so, and I think it helps, when I chat with the team, we really make an effort to understand the big picture. Yes, we're a team of IT folks, but we understand that there's more to it than just, a switch in a closet. That switch supports nurses, which support obviously patients. So, but I think again, having that CIO experience really, helps me again see that big picture much more clearly than had I not had it.
Yeah, I think that's incredible insight. And I always talk to our teams about being students of, and the business we're in is healthcare. We wake up every day at the intersection of healthcare and IT. So be a student of IT, and then figuring out how do you overlay that onto, what it is you're doing in your role. And I think you've done that in your career very successfully. So picking up all those things throughout those years, now it culminates into this role, and you're applying all those learnings into this role. That's excellent. So I live in Kansas City, and our offices, our headquarters are in Alpharetta, Georgia. Right. You live in Ohio.
Correct.
And, Moffit's in Tampa. We're both examples of this hybrid workforce. I mean, I travel a ton. I assume you get down to Tampa quite a bit. There's a lot of people in our kind of structure of work these days. And, I've got my ways of trying to balance that. How do you balance the travel and the hybrid stuff? It's a lot. It can become a lot on a leader specifically. Yeah. So I'm just curious how you've created some balance around all that.
To me, it doesn't matter if you're on site or if you're hybrid like us, or if you're 100% remote. Being present and being visible, there's ways to do that, just like we're doing today. I think that's key. When I travel on site, it's not to force people to come in by any stretch of imagination. If it works out that that my leadership team can be in on site, great. I think above all else, you kind of forget about the travel piece of it. It's just being present for those folks and including folks. And you can include folks easily on a Zoom call as you can, and an in-person meeting. That's the focus. It's not so much on the travel. It's making sure that I'm present and visible. Whether it's skip level meetings or just offering up time. I spend a lot of time really inviting folks into conversations because I value their input. And I think it's important for them. So, I got a lot of team that's 100% remote.
Yeah.
If you're on site or not right now, they're not coming in. Or they might live in Texas.
Right. Yeah. I mean, we're seeing that, and that's actually, the reality is the population of which you can recruit from has, grew immensely post-COVID, in the sense that, the virtual world has opened the talent pool up to just about everybody. And that creates opportunity, creates challenge. You guys got a lot going on. So inside of all of that people can get burnt out. The stress levels are high. On top of just running an IT organization, you got a lot of projects happening simultaneously. How do you one personally deal with keeping yourself from getting burned out? But then how do you think about working with your teams to identify if burnout's occurring and what you guys do to manage through that?
So I'll start with the teams first. We ask the question, is this too much? Does this put too much of an onus on you, your teams, your staff? And we asked the front end, team as well. If we go this route, because again, they're part of the decision-making process. So they're there at the beginning, and they're there all the way through. Now, we may not obviously, take somebody's idea and run with it every single time. So we ask that question, and we ask it a lot, because you're right, we do have a lot going on. Last year, while we were finishing up, the building of the hospital, there was a lot of answers of, no, we can't get to that now. Let us get through the opening of the hospital. Give us 2 months to make sure that we're solid there, and then we'll pick back up. So I'm very cognizant of that, and we really try to be very mindful of people's time.
Yeah, I love that answer. I love that you're transparent. I love the fact that you engage your associates in trying to be part of the solution. You ask the question directly. Sometimes you want to know something, just ask, right? So, putting it out there, is this too much? Being kind of self-aware of those things and being willing to make it a safe zone environment that people can bring this up without retribution. I love all those things. So that's excellent stuff. Well, Seth, this has been great. Really appreciate your time. I really appreciate your insights. You guys are doing wonderful things down there in Tampa at Moffit. And I know you're, saving lives and hopefully, learning something every day through your research that's going to save even more lives. So I'm really, really, really thankful we could spend some time together and appreciate your time.
Yeah, Ben, thanks for having me. I enjoyed it.
You bet.
Seth has a big job in front of him managing all the growth at Moffit. Here are my top takeaways from our conversation. 1, expansion and patient growth mean more data. In a growing organization, data governance is critical for scalability and long-term success. 2, Seth is transparent about exploring outsourcing and other workforce solutions. He wants his department to know that he's trying to augment their skills and not replace them. 3, before committing to a large project, Seth will always ask his managers, are we doing too much? Leaders have to be cognizant of workload and the potential for burnout, especially in a growth organization. So what did you think? What were your big takeaways from this episode? I'd love to hear from you on our social media channels or drop me an email from our website at healthcareitleaders.com.
Thanks for joining us for Leader to Leader. To learn more about how to fuel your own personal leadership journey through the healthcare industry, visit healthcareitleaders.com. Don't forget to subscribe so you don't miss any insights, and we'll see you on the next episode.